Blessings and peace, everyone, and welcome back to the Autoimmune Recovery Room, where autoimmune warriors unite. I hope everyone had a blessed and wonderful Thanksgiving. My name is Diana Carroll, and for those who are just joining, I want to start by saying this video is intended for informational purposes only and is not a substitute for medical advice, diagnosis, treatment, or pharmaceutical guidance. Always consult with your healthcare provider for any health concerns. So, what the heck is an autoimmune disease? This is a question I asked in 1980 when I was diagnosed with the first of 9 autoimmune diseases. I had no idea what it meant or what I was about to face. That's why the Autoimmune Recovery Room exists, to help others who may feel as lost as I did. An autoimmune disease occurs when the immune system, which is designed to protect your body from harmful invaders like bacteria, parasites, viruses, mistakenly attack your own tissues. Autoimmune disease can and often does affect various tissues and nearly any organ in your body. Symptoms vary widely, including pain, fatigue, rashes, nausea, and more specific signs depending on the disease. There are over 100 known autoimmune diseases. Over the next few weeks, I'll shed the light on many of them. Rheumatoid arthritis is the first on my list. Body parts, tissues, systems that are affected. Joint lining is primarily in your hands, your wrists, your knees, can also affect your lungs, skin, heart, and blood vessels. Symptoms are joint pain, stiffness, worse in the morning, swelling, fatigue, weight loss, low-grade fever. Risk factors: female, sex, ages 30 to 50, family history, smoking, obesity. Complications: joint deformity, osteoporosis, cardiovascular disease, lung disease. Prone to women versus men, 2 to 3 times more common in women. The next on the list is systemic lupus. This attack causes inflammation and, in some cases, permanent tissue damage, which can be widespread. So the body parts, tissues, and systems that are affected are your skin, your joints, kidneys, brain, lungs, heart, and circulating blood cells. Lupus can cause serious kidney damage and kidney failure. Symptoms: butterfly-shaped facial rash, joint pain, fatigue, fever. Neurological symptoms include headaches, dizziness, and seizures. Photosensitivity is another symptom. The risk factors are female, sex, ages 15 to 45, African, Hispanic, or Asian ancestry, family history, sunlight exposure are some of the risk factors. Complications: kidney failure, cardiovascular issues, strokes, and seizures. Prone to women versus men, 90% of the cases occur in women. The next on the list is type 1 diabetes. Body parts, tissues, and systems that are affected: your pancreas, destruction of insulin-producing beta cells. Symptoms: increased thirst, frequent urination, extreme hunger, weight loss, fatigue, blurred vision. Risk factors: family history, childhood viral disease, infections, European descent. Complications: cardiovascular disease, kidney disease, nerve damage, blindness. Prone to women versus men, equal prevalence. The next on the list is Hashimoto's thyroiditis, and the body parts, tissues, and symptoms that it affects is your thyroid gland. Immune attack leads to hypothyroidism. Had that. Symptoms: fatigue, cold sensitivity, weight gain, dry skin, hair thinning, goiter, enlarged thyroid. Risk factors: female, 30 to 50, family history, iodine excess or deficiency. Complications: hypothyroidism, goiter, and heart problems. Prone to women versus men, 8 times more common in women. I don't know what's going on, ladies, but we're catching it here. Graves' disease, body parts, tissues, and symptoms that are affected is your thyroid gland. Hyperthyroidism, had that. Symptoms: nervousness, rapid heartbeat, bulging eyes, heat intolerance, goiter. Risk factors: female, sex, stress, family history, smoking. Complications: thyroid storm, a rare and life-threatening condition. Signs of having it is a high fever, a temperature between 104 and 106 degrees, osteoporosis, and heart problems. Prone to women versus men, 7 to 8 times more common in women. Multiple sclerosis, body parts, tissues, systems affected. Central nervous system, your brain, spinal cord, optic nerves. Symptoms: numbness and weakness in your limbs, vision problems, coordination and balance issues, fatigue, cognitive dysfunction. Risk factors: female, ages 20 to 50, low vitamin D, Epstein-Barr virus infection. Complications: progressive disability, bladder and bowel dysfunction, mood disorder, mobility challenges. Prone to women versus men, women are 2 to 3 times more likely to be affected. Sarcoidosis, the growth of tiny collections of inflammatory cells, granulomas, in any part of your body, most commonly in the lungs and lymph nodes. There is no cure. About 1 to 8% of the cases are fatal, and it depends on the severity and location of the disease. Some science research suggests that infectious agents, chemicals, dust, and potential abnormal reaction to your body's own proteins, which could be responsible for the formation of granulomas in people who are genetically predisposed. Body parts, tissues, systems affected: your lungs, most common, skin, eyes, lymph nodes, heart, and liver. Symptoms: fatigue, fever, swollen lymph nodes, persistent cough, shortness of breath, skin lesions, eye redness and pain. Symptoms sometimes develop gradually and produces symptoms that last for years. Other times, symptoms appear suddenly and then disappear just as quickly. Risk factors: age 20 to 40, African or Scandinavian descent, family history. Complications: pulmonary fibrosis, cardiac sarcoidosis, vision loss, kidney damage. Prone to women versus men, slightly more common in women. My personal story: the day I was diagnosed with sarcoidosis. Months before my diagnosis, I experienced relentless fatigue, spots and floaters in my vision, shortness of breath, and wheezing. Despite regular visits to the doctor and numerous tests, the results showed nothing. My doctor suggested that my symptoms might be psychological, possibly relating to my recent divorce, and recommended I see a psychiatrist. Frustrated but desperate for answers, I agreed. After spending an hour with the psychiatrist, he concluded there is absolutely nothing wrong with my mind. Your doctor needs to do his job and find out what is happening. I returned to my doctor, who then admitted me to the hospital. A biopsy was performed, and initially I was told I had cancer. However, further examination revealed a diagnosis of sarcoidosis. My response: what the heck is sarcoidosis? The question marked the beginning of a nightmare. My symptoms worsened: extreme fatigue, swollen lymph nodes, weight loss, lung involvement, and persistent dry cough, shortness of breath, and even coughing up blood. I endured frequent hospital stays. A rash of reddish-purple bumps on my legs, disfiguring lesions, blurred vision, cysts on my kidneys and liver. The most terrifying part was heart involvement. That is when I received my first prognosis: you have 3 years to live. With sarcoidosis of the heart, I was warned that sudden death was a real possibility. In 2000, I was again told I would not survive another 3 years without a heart and lung transplant. I did not undergo either procedure. To complicate matters, the medication I was prescribed caused significant damage, leading to 9 surgeries over time. Yet through it all, I had held on to my faith. Oh, but for the goodness of God, still I rise. To this day, I continue to live with sarcoidosis, and while the battle is not over, knowing what to expect has made all the difference. It has empowered me to take better care of myself. Self-care is vital. It is an ongoing journey and a learning process. So to recap, there are key takeaways. Number 1, autoimmune diseases arise when the immune system mistakenly attacks the body. Number 2, symptoms and outcomes vary widely between individuals. Genetics often play a significant role, but environment and lifestyle also contributes. Remember, 2 people with the same diagnosis can have vastly different experiences. For example, while I faced severe challenges with sarcoidosis, my aunt had a much milder course. I want to thank you for joining me in the Autoimmune Recovery Room. If you found this information helpful, please feel free to share it and to feel free to leave your own experience or questions in the comments. So until next time, remember, you are stronger than you know, and this community is here to walk alongside of you in your journey. Bruised wings can still fly. Blessings and peace to all. Thank you for joining me.